one possible manifestation of allergies is food allergy. Most often, of course, this occurs in infants, especially in infants. Why? Because there are episodes of dietary mistakes. On the part of mothers who are breastfeeding these children, it could also be due to the introduction of complementary foods at the wrong time or in the wrong way. Of course, these are potentially allergy-triggering foods. You should always keep them in mind. They include blood and milk, eggs, various types of fish, exotic vegetables, fruits, and chocolate. Some of them are direct allergens, while others cause pseudo-allergic reactions. But nevertheless, all of them can trigger allergic manifestations in a child. With contact dermatitis, rashes appear on exposed areas of the body, such as the face and hands, while with food allergies, they can occur all over the body. And of course, depending on how quickly the immune system reacts, various manifestations are possible. Symptoms may appear either within a few hours or after several days. The pattern and location of these rashes also depend on age. In young children, the rash affects the cheeks, areas behind the ears, the folds of the limbs such as elbows and knees, and sometimes the groin, hairy part of the head, body. In older children, from ages 2 to 12, the rash most often appears on the neck and elbows. In adolescents, allergies are characterized by rashes on the face, hands, skin, and the backs of the hands. It can cover the entire torso. Characteristics of the rash. Let me remind you of the main symptoms. These are intense itching, redness of the skin, swelling, pronounced and roughened skin texture, dryness and thickening of the skin, lichenification and the formation of pigmented spots on the skin. The skin takes on the appearance of fish scales. In severe forms of the disease, when a secondary infection joins in, fever and enlargement of the lymph nodes are possible. And the skin remains persistently weeping, and of course children become fussy and irritable. Dark circles appear around the eyes, unhealthy circles around the eyes. As for introducing complementary foods to these children, if you know that your child suffers from allergies and you see these symptoms, what the rule is important. It is not recommended to introduce complementary foods consisting of several products at once, and not more often than once every 7 days. This way, we can track which product causes negative reactions in this particular child. If an acute reaction occurs, you can replace this product with the previous one that has lower allergenicity. But it is still possible to return to the product that caused the allergy about 8-9 weeks after the child was first introduced to it with this allergen. Unfamiliar foods that you are going to introduce to your child, it is preferable, of course, to introduce after feeding. Not before feeding, but after feeding. And it is not advisable to mix them with other foods. Most often, the skin manifestations appear as increased sensitivity, dryness and flaking of the skin and skin thickening. This is more a manifestation of atopic dermatitis after all. This is something you need to keep in mind. So, to relieve itching, of course, you can use antihistamines, but it is still preferable to remember that they should be second generation and a hypoallergenic diet. It is an important component in the management of these patients. Or for mothers who are breastfeeding such children, please, mothers, eliminate all red-colored fruits and berries. Also juices and vegetables. We have already talked about fish and seafood, cow's milk, oranges and tangerines, grains, eggs, greens. Any preservatives, emulsifiers, sauces, smoked foods, chocolate, drinks, sweet carbonated beverages. If you have a child at home suffering from allergic dermatitis, you need to follow certain care rules. Do wet cleaning in the rooms daily. Do wet cleaning and air out the rooms without using chemicals. Change the child's underwear daily and use only hypoallergenic products. These are linen and cotton fabric. And when bathing, it is forbidden to use gels, soaps, foams, liquid soaps, and washcloths. Before going outside, in winter, it is advisable to apply baby cream to the child's face. In summer, it is recommended to use sunscreen. In severe cases of allergic dermatitis in children, hormonal medications are used. These are topical glucocorticoid medications, Alacoma, Advantan, Dermovate, hydrocortisone. In the future, with frequent relapses, with frequent in children, with frequent relapses, we are forced to switch to systemic therapy. The essence of the method is that purified substances from allergens, which are considered to be the cause of this particular disease in the child, are introduced into the body in measured doses so that the body itself can develop immunological tolerance to these substances. The first year of life, prevention of allergic diseases in children is breastfeeding. Mother's milk protects our child, shields them from allergens, and improves the functioning of the immune system. And it is desirable for parents to remember that the child should be protected from aggressive substances, household chemicals, and low-quality food products that they themselves consume.